So, hello, fellow doctors. Today we just want to clarify a few things concerning the usage of the pliers, the thermoforming pliers with clear aligners, and how beneficial it could be to actually get really good results. We've been receiving so many questionnaires about how to use the pliers. So today I just want to brief things up and just clarify how they are used. So for now, first, this is the thermoforming plier that we have, and it could come in many different sizes, whatever suits you most. But some of them are for rotations, some of them are for labial and lingual movements, some of them are for interdental, forces. It's whatever it is, okay, just make sure that you're getting the right plier for the right usage. And they're actually marked sometimes, that depends upon the company, but they're marked with these color bands. One of the most important things that I always tell my clients or whoever uses pliers is just make sure to use this screw here, okay? It comes with a key so that you could actually just put it in there and try to screw this screw in order to reach the depth that you want with the beak of the plier. So this is one of the most important things in the plier, is to know exactly how much impingement or how much depth you want to reach with this beak. Now, for example, when we get, let's say, like a patient who comes and at the same time this patient has, let's say, lagging tooth, okay, the tooth is not moving pretty well. Like, for example, here, okay, we could see that the lower centrals, okay, did not move quite well lingually as, let's say, planned, for example, okay? So if in the clinical finding, when you find the lower centrals did not move pretty well and while they have been moved in the aligner in the right position, so that means that you're having a lagging tooth, so you have to push a little bit more. So what you do is that you could push them very easily with a plier that you have in your practice. Yeah, in your practice, you could just push it like that, okay, to the full extent, okay, and let's say this one too over here, okay. I tend to usually use them on either cervical parts or on the whole mid part of the tooth in order to move it efficiently. Now from inside, it's just a small bump. I don't know if you can see that or not, but it's just a very small bump in there, okay? And these actually give more forces and give the desired outcome that you need in order to move the tooth. So the patient just wears this same aligner again for an average of 1 week, and then the patient could come to your practice once again, and you'll find the tooth that or the two centrals, they've moved efficiently. Sometimes we could use it even for derotations, like for example, if we want to derotate this canine in a mesial in direction. So what I do is just to, the mesial labial surface, I just add a notch over there, and on the distal lingual part, I just add another one over here, so that I have a notch on this side and that side in order to help the canine to derotate pretty more efficiently. These actually are very efficient, and I recommend every dentist who uses clear aligners to use the thermoforming pliers. They're very efficient. But you have to take care when you deliver this aligner that the patient will, first exhibit some difficulty in wearing the aligner. It could give more forces. It could be even not that seating on the teeth. You have to comfort the patient, tell them that it's going to be okay and that it's going to be fitting really good within the next, let's say, 2 days or so. Take care not to make this beak actually make a notch more than 1 millimeter or 2 millimeters maximum, because other than that, it would make some root resorption. So just take care of that to apply some good forces, but at the same time to be acceptable and friendly forces. Now, sometimes if you have an aligner that is not seating pretty well, what you could do is also that you could go interdentally between teeth like that and just try from the labial side and also from the lingual side to give more retention on these sides. So by this, okay, you have these indentations on the labial side and on the lingual side. Both of them give very good retention, and you could do that on the left side and the right side in order to get a very good retention for the aligner and teeth. So that is it. This was presented by K-Line Europe in Germany, and yeah, we'd be happy to post more videos very soon to explain furthermore thermoforming pliers and how they could be used. Thank you.